This meeting is being recorded.
Sorry, everyone, I'm just waiting for the recording to start. Thanks, Gersh. So welcome, everybody. I am Charlotte Underwood from Health and Wellbeing. And today what I'm going to do is showcase some really simple techniques for you all to hopefully take away with you to support you with some of these symptoms that you may experience going through the different stages of the menopause. There's loads of listed symptoms that we may experience, but I'd like to do a real focus around musculoskeletal issues because a lot of the clients that I see are really struggling, particularly in the head, neck and shoulder area. And also with anxiety as well. So I'd like to bring in a little bit of a breathing and relaxation exercise to this session as well, so that you've got that in your wellbeing toolkit, so to speak, so that you can apply that whenever you need to. So we're going to do some exercises, but everything will be really safe and simple to follow. We're going to do everything in a seated position, so everything is non-weight bearing. If any of you do have any mobility issues, particularly around the neck and shoulder area, I'm just going to ask you all to stay within what I call your safe comfort zone. So don't overstretch, just make sure that it's really comfortable in the stretch, it's almost quite subtle, and that you don't push yourself too far. This is all about really gentle and safe techniques to really support your well-being. Now, you don't have to have your cameras on if you don't feel comfortable with those on, that's absolutely fine. If anybody is struggling in the actual session, if you want to just unmute yourself and directly ask me a question, you know, that's absolutely fine, or you can send something through the chat. We can keep an eye on that for you as well, because Gersh will be present in the meeting. What I will do at the end as well is I'll stay on for about 10 minutes at the end or a little bit longer afterwards in case any of you want to ask me any questions directly. Okay, so but like I say, feel free to ask via unmuting yourself if you've got any issues. So just get yourself nice and comfortable in your seat to begin with. And if you can, just let your arms just fall really loosely by your side so that your fingertips feel really nice and relaxed. And just have your back as straight as you comfortably can in the chair. If you're struggling with the arms, if you're on a chair with arms and it's quite difficult to hang your arms over the side, don't worry, just rest your hands onto your knee, whatever feels comfortable for you. The key is that we're just going to try and aim to get these shoulder areas as relaxed as possible, because this is where we see a lot of tension in ladies going through the various stages of the menopause. So what we're going to do is I'm going to begin the session with showcasing a simple breathing technique. This breathing technique can be used whenever you're feeling anxious, and anxiety is one of the symptoms that a lot of ladies report to me. And it can be anxiety that can wake you up at 2, 3 in the morning, and it can be a real struggle to get back to sleep as a result. Some ladies experience it as they wake in the morning. They feel almost a sense of impending doom and they don't know why, and it's difficult to shake that feeling. Now, what a simple breathing technique like I'm about to showcase can do is really help you with the reaction to that feeling. So it helps us to come back and look at something from a slightly different perspective, and it helps to calm that nervousness feeling, almost that jumping up and down inside your tummy that you feel when you feel that level of anxiety, and it can come over in sudden waves. So the breathing technique is really valuable for us all because it's free to use, it's in our tool belt all of the time, so we can apply it whenever we need to. And you can apply it quite discreetly as well if needed, but you can just take yourself off just for a couple of minutes, apply the technique and then come back to the situation. So really helpful if you're in a busy work environment. So I'm just going to get you all, if possible, for this breathing session is to just close your eyes, because this will allow you connection with your mind and body. And this is really important for us to apply regularly because it's not something we do. We don't often ask ourselves if we're okay or do this self-check-in. So it's all about forming a really healthy self-care routine each day to support you. So if you can close your eyes and just let your arms just relax as much as possible, either down by your side or hands rested onto your knee. And then I'm just going to get you all to just start breathing in through your nose and then just out through your mouth, nice and slowly. And just repeat this a couple of times. So you're inhaling through the nose and you'll exhale through the mouth. And just keep repeating, just feel that flow of the breath. So breathing in through the nose and out through the mouth. Once we've got used to that, just for a few more breaths, what I'm going to do is I'm going to count us through a few breaths, just getting us used to breathing out for longer than we breathe in. So I'm going to get us to do something called the 3-6 breath. So we breathe in for the count of 3. I'll get us to take a small pause at the end of that intake, and then I'll get you all to breathe out if you can for the count of 6. Now, please don't worry if you don't make it to the end of 6 initially. It can be quite challenging when you're focused on the breath work. So it's just about taking it nice and slowly. Okay. So when you're all ready, keeping your eyes closed, we'll breathe in through the nose for 1, 2, 3. And just pause for a moment if you're able to. And now exhale for 1, 2, 3, 4, 5, 6. Lovely. Just breathe in and out normally, just for a couple of seconds in between. And then keeping the eyes closed, when you're ready, we'll go again. So breathing in through the nose for 1, 2, 3, and pause. And now exhale, 1, 2, 3, 4, 5, 6. Lovely. And then when you're ready, we'll go again for 1/3 breath, okay? So breathing in for 1, 2, 3, and just pausing if you can. And now exhaling for 1, 2, 3, 4, 5, 6. Well done, everybody. Now just slowly bring yourself back to your surroundings. Some of you may find that you feel a little bit dizzy after closing your eyes. So if you've noticed that you do, just cross your hands over your chest like this. Make sure your feet are firmly on the ground. This will just help to stabilize you and just give yourself a moment to come round, because you can feel quite lightheaded, and that's just taking literally a minute out of your day just to focus on you, just to focus on your breath. And what that will do is it will reset the mind and body almost, so that you're not feeling quite as anxious, and that you're able to come at something from a much calmer perspective, and it will help to reduce those overall feelings of stress that we can experience. Particularly helpful, like I say, if you are somebody that wakes in the middle of the night, you'll have the weight of the world on your shoulders at that time of day, or night, sorry. And it's really useful to just keep practicing the breathing technique. If your mind wanders as you're doing it, just keep bringing yourself back to focusing on counting your breath, and eventually the nervous system will calm down, your body will calm down. And once you start to feel that level of weightlessness, you should hopefully be able to ease back into sleep a little bit better. Okay, so well done, everybody. We're going to incorporate a bit of breath work into the actual session as we do some of the stretches, because what happens is the fascia, which is your body's connective tissue around the individual muscle fibers, that gets quite clogged with hormones that we release through stress situations, and we can really manifest stress very physically in the body, particularly in the neck and the shoulder area. So when we stretch the fascia, it's really useful to breathe in and out as we do, so that we help with that release process. Okay. So we're going to start with the shoulder area, because that is quite significant. I see, like I said at the start, ladies going through menopausal changes, really struggling with the shoulder area and a lot of tension in there. So I'm just going to get you all to follow me. Just place your fingertips onto your shoulders to begin with. And then what we're going to do is bring the elbows forward. We're going to roll them up and then back. Okay, so it's almost like you're just doing circles with your elbows, and what you should feel is a really nice stretch under the shoulder blades as you do this. So maximize that stretch as much as you comfortably can. So like I said at the beginning, don't overstretch if you have mobility issues. If you've perhaps got, say, a frozen shoulder on one side, just drop the arm on that side and just do the shoulder that you can. If you have issues on both your shoulders and you're unable to make that full stretch, just do some very gentle shrugging like this. Whatever's going to work for you, just to help get a little bit of mobility going. So we'll just do 2 more in that direction. Good work, everybody. Then just have a pause for a moment. Take a nice deep breath in and out. So breathing in through your nose and just out through your mouth. We don't have to count them, just making sure you're supplying your tissues with oxygen as we go. And then we're going to take the elbows now in the other direction. So this is a bit like a land butterfly stroke. So we go backwards first, then up and over. So again, back, up and over. Now, don't worry if you're experiencing a little bit of cracking, crunching noises going off. This is quite normal if we're harbouring tension in those areas. So just allow that breathing normally if you can. Try not to hold your breath in concentration. And just keep that rotation going so that we really loosen the pressure off in that area. And then just let your arms just fall really loosely by your side. And another nice deep breath in through the nose. And then out through the mouth. Excellent. And then just let your arms fall by your side. Well done, everybody. We'll now start to mobilize the neck. The neck harbours a lot of tension. It can be a real contributing factor tension here to headaches that can be really quite debilitating during the menopause and during any stages of it, perimenopause right through and post-menopause. So it's really important to try and release this area. So to begin with, all we're going to do is a really simple technique where we're actually just looking to the left shoulder and feeling a really subtle stretch here down the right side of the neck, keeping the shoulders as relaxed as possible. Now move slowly back to the center first, and then take your head to your right shoulder. You might notice here that you're struggling to go as far on one side compared to the other, and that's quite normal. We all have postural imbalances, so it's nothing to worry about. Come back to the center and take it to the left one more time. Feel that nice stretch, but nothing beyond that. And then back to the center and one more time to the right, keeping your shoulders as relaxed as you can. And then back to the center. Well done, everybody. Okay. We're now going to do a tilt with the head, which deepens the stretch in this part of the neck. So again, go steady with this. If you're struggling with this, don't go too far. Just even if it's a millimetre that you move, just very gentle stretching. So we're tilting the head to the left shoulder to begin with. And be mindful about where your shoulder is on this. Don't bring it up to meet the ear. Just keep it as relaxed as possible. Feel that stretch here down that right-hand side of the body. Okay. Now bring your head back to the center and tilt to the right shoulder. Again, just feel that stretch down that left-hand side of the body. Back to the center. Now, if you're able to, we're going to deepen this stretch ever so slightly. And if anybody does have mobility issues around the neck and shoulder, you might just not want to deepen this. It might feel a bit too much for you. So just go with what's comfortable. So what we're going to do is tilt again to the left shoulder. Then I'm going to get you to take a deep breath in. And as we breathe out through the mouth, drop that right arm down. Imagine a heavy shopping bag is just pulling the arm down slightly, and you will feel the deepening of the stretch here, just across the top of the trapezius muscle here. And it can feel quite a deep stretch. So if it's too much, just relax and just tilt the head. Now bring yourself back to the center, relax that shoulder. And then we'll repeat on the other side. So tilt your head to the right shoulder. When you're ready, deep breath. And as you breathe out through the mouth, drop that left arm down a little bit. Imagine that heavy shopping bag, pulling it downwards so that you really deepen the stretch into the shoulder. Lovely. And then relax, bring everything back to the center. Well done, everybody. Okay. We're now going to deepen the stretch in the side of the neck here that we did just when we were looking over the shoulder. And we're going to do that with a little bit of breath work. So what we're going to do is turn the head to the left shoulder initially. Once you're in that position, I'm going to get you to take a deep breath through your nose. Then as you exhale through the mouth, we'll just take that stretch a little bit further. So I'll just demonstrate before you all follow me. So taking it to the side, at that point, as I breathe out, it's only a slight more movement that I'm using here. So it just deepens the stretch in there, but it doesn't feel unpleasant. So even if it's just a millimetre that you can move, it's just, you will notice that you can just look slightly further over the shoulder, but we must use the breath work to facilitate this move, okay? So when you're all ready, taking your head to the left shoulder to begin with, shoulders nice and relaxed, then take a deep breath through your nose. And as you breathe out through your mouth, just take that stretch ever so slightly further, relaxing those shoulders down and just hold in position. Now slowly come back to the center. And then just repeat on the right-hand side when you're ready. So again, not pushing too far. Once in position, take a deep breath through your nose. And as you breathe out through your mouth, take that stretch a bit further. Hold in that position if you can. And then bring your head back to the center. And again, don't worry if you get a few pops and cracks going on. That's quite normal as we mobilize the joints and we stretch the muscles. Okay, well done, everybody. Now, the next one that I'm going to showcase, I always call this one the pendulum roll, and this one can be quite noisy in the back of the neck and the shoulders. You can get a lot of pops and fizzes that go off, which can alarm people when they first do this move. But this is a really good one to do on a daily basis if you can, especially if you're suffering with headaches and tension in that particular area. We're all guilty of applying what we call lots of load pressure to the top of our shoulders here, because we do it naturally when we're looking down at gadgets. So we're looking at our phones quite a lot. We might be reading a book. We're on laptops or computers a lot of the time. And that does apply a significant amount of pressure here on the top of the shoulders. So it's really good to make sure daily we mobilize the neck joints and free those shoulders up of that pressure, particularly as our bone density starts to diminish during the menopause. And, you know, muscle loss can be significant as well. So we need to make sure that we're building resilience around the muscles. So we're doing a little bit of resistance training and just making sure that we're really resilient towards any external stress factors. So things like having to look down at gadgets, it just means that we're stronger and we can cope with that a little bit better and support postural changes. So I'm just going to get you all to slowly lower your chin down towards your chest. And just stop when that feels like you actually notice the stretch. The stretch may only be down to your neck point. Some of you may actually feel that running further down the spine, and that can be quite normal if that's tense. So just stop when you notice that. Now, very slowly, just roll your chin towards your left shoulder to begin with, and only go as far as you comfortably can in the stretch. And now very slowly go back towards the center and then to the right shoulder. And now repeat one more time. So going back to the center and slowly to the left. And then again, back towards the center and slowly towards the right. Now from that point, take yourself back to the center, but don't lift your head up immediately. Whilst your chin is down, just take a nice deep breath through your nose. And now as you exhale through your mouth, bring your head slowly back to that central position. And just automatically cross your hands over your chest like this now, because you can feel quite dizzy from having your head hanging down. Okay, lovely. Well done, everybody. We're now going to lower the hands to that position. So just sitting above the elbow crease. And what we're going to do is draw a figure of 8 with our shoulders. So this is a really nice one for releasing pressure in that top segment of the spine. Okay, so we're going to start with that left shoulder. We'll roll it backwards first, and then we'll move on to the right side. So as you can see, I'm almost drawing a figure of 8 with my elbows. Okay, and the higher that you lift the elbows, the different area you will stretch in the top part of your back. So just have a little play around with this one, whatever feels comfortable for you. Once you get your movement, your mojo going with this one, you might want to bring your hands up a bit higher and see where that stretches, because that stretches more of the top part as well. So just see what works for you. Nice gentle movement. Just ignore the cracks and crunches as they occur. It's quite normal. I'm getting lots and I do this regularly, so don't worry about it. Okay, it's just to feel, notice that nice release that you get, feel that pressure give way. Okay, lovely. And just a couple more. And then just let those arms hang really loosely by your side. Well done, everybody. Okay. So we're now going to lower the chin down again, just like we did before. And this time when we're in that position with the chin down towards the chest, I'm going to get you to bring your shoulders up like this towards the ceiling, and then we'll lower them back down. And we'll repeat that a couple of times. And again, at the end, before you bring your head back up, we'll do the breathing technique and I'll talk us through that. So don't rush back up to bring your head back up. So when you're ready, just slowly lower your chin down towards your chest. And just relax in that position for a moment. Let those shoulders really relax. Just breathe in and out through your nose. And just relax, okay. So when you're all ready, we're going to shrug those shoulders up towards the ceiling, keeping the chin down towards the chest. And now relax them right back down. Imagine that something's pulling downwards on the blades to really promote the relaxation. And then when you're ready again, shrug the shoulders up towards the ceiling. And then relax them back down. Okay. Now, before you bring your head back up, take a nice deep breath in through the nose. And as you exhale through the mouth, slowly bring the head back up to position. Okay, well done, everybody. If anyone feels dizzy, just do your crossover like I showed you at the start. And what we're going to do from this point is we're going to go back to one of the first moves, which was the shoulder rolling, because I'm hoping that this will feel a bit smoother for you all now. So just have a go at the backwards one first. So bringing the elbows forwards and then back. You may still be crunching a little bit. My right shoulder definitely is. It's quite clunky. That's quite normal for me. So don't worry, but it should just feel a little bit freer and a little bit lighter in there. And then when you're ready, we'll go in that opposite direction. So backwards and over. Really maximize the lift on the scapula. So maximize the lift on that shoulder blade in there. Well done, everybody. Okay, lovely. And then just let those arms fall down by your side. Just give the arms a little bit of a shake off. We're going to do some work on the arms shortly, because one of the things that a lot of ladies report to me is muscular aches, and almost like some ladies just get very achy in the forearms. Some ladies get almost like a feeling of an electric shock running up and down their arms. Some it's almost like their elbows feel inflamed, their wrists feel really inflamed. All of these are really common symptoms of going through the menopause. Yeah, somebody's acknowledging that now. So yeah, it is. And it can be really debilitating. It can feel like you've just got no strength in your hands whatsoever. People can experience just dropping simple things, like when you're pegging your washing out, you're dropping your pegs and you're dropping things because your arms just feel very, very weak. So we'll do a nice stretch out shortly in the arms, so I can showcase that for you, and that should hopefully support you with those symptoms. Okay, so we're just going to continue with the shoulders for a little bit longer because I really want to build in some strengthening to those. Okay. So what we're going to do is just a really gentle exercise, which really helps to build strength around the back side of the shoulders. So that half moon shape around the shoulder blade, where really it's lovely to have a massage because the therapist is working up and around the shoulders. This can really have the same effect, and it builds strength at the same time. So I call this the aeroplane move. So for this one, if you can have your back as comfortably straight as you can, and then all we're going to do is just take the arms out to there, so no higher than that point. Shoulders as relaxed as you can. And then I just want you all to imagine that I've walked behind you and I'm pulling down on the tips of your shoulder blades. So if you just look at my collarbone area here and my shoulders, you'll see a slight drop, but I'm not arching my back. I'm just pulling down on those shoulder blades and I'm just holding into that position. So once you're all in that position, don't hold on to your breath, just breathe in and out through the nose and the mouth as I showed you at the start. Just keep breathing, that's good. And then just relax the arms down by your side, okay? From that point, just do a couple of shoulder rolls where you bring the shoulders up towards the ears and you roll them back and round. So you bring the shoulders up, roll back and round. And then repeat, so take the arms just out to there and pull down on the tips of those shoulder blades. Keep your back as straight as you comfortably can for this one and breathe as normal. Okay. And then relax everything down. Do a couple more of those shoulder rolls just to free off that tension that builds up as you lift the arms up. Well done, everybody. That's great. Okay. So we're going to now focus on the arms as promised, and we're going to work really gently here, because if any of you ladies are experiencing this type of tension and aching in the muscles, particularly here, which is quite common, this can be very, very sensitive when you first do this. I just want you to take this really carefully. If you've got a bit of sensitivity, just loosen off so you don't overstretch. So all we're going to do is just hold your hand out in front of you and just hook your fingers like this, okay? And then very gently, I'm just pulling up on my hand like this, okay? So I'm just going to turn there so that you can just see. I'm just pulling back, okay? So my arm is nice and straight. And where you should feel the stretch is under here, but it shouldn't be painful. If it's painful, you're just pulling back a bit too far. So just relax and just give it a very gentle stretch. So it's these muscles here, okay? And whilst you're in that stretch, I just want you all to take a deep breath through the nose. And then as you breathe out through the mouth, take the stretch slightly further if you can. And then just relax, just give that hand just a little bit of a shake. Okay, well done. And then we're just going to repeat that on the other side. So just hooking in and then pulling back, but gently, okay? So making sure it's not hurting. And then once you're in position, just take a deep breath through the nose. And then as you breathe out, increase slightly so you feel that subtle stretch down in there. Okay. And then just give the wrists a shake out. Okay. Well done, everybody. We're now going to interlock the fingers like this, hold them against the chest. And then when you're ready, we're going to turn them the other way. And then what we're going to do is stretch the arms out in front of us. And this again should feel like a nice stretch. So you should feel it running all the way up both parts of the arm. Relax the shoulders as much as you can. So if you're noticing you're doing this, bring them down. So the hands are almost at your chest height like me. Keep your back nice and straight. Okay, now take a deep breath in, and as you do, bring the hands back to the center of the chest. And now I'm going to get you to breathe out and bring your arms straight up above your head and look upwards as you breathe out. Okay, well done. Breathe in, bring the hands back to the chest. And breathe out and stretch them out in front of you. Again, enjoy the stretch down the arms. And again, breathe in, back to the chest. Breathe out, up above your head. Look upwards as you breathe out. One more time, breathing in, bring them back down to the chest. And breathe out and ahead of you. Now just let them relax down by side. Start to just give them a little bit of a gentle shake, okay? And now I'm just going to get you all to just rock the arms just back and forth if you're able to. If you're on a chair with arms, just try and come to the edge of it, or maybe stand up just to do this. Just let those fingertips feel nice and light. Just imagine any residual pressure in those arms is just moving out. It's really good if you feel that aching setting. It really helps to combat some of those symptoms, but it is important for us to stretch the arms. We kind of neglect them a bit. We forget about the arms. You really notice tension building up more in your neck and shoulders, and you don't notice it building up in your arms until you really get those unpleasant symptoms of that dull aching or those electric shocks running through, which can be really debilitating, like I said. So it's really good to just exercise them daily with just some gentle stretching like this. Okay, well done. So we're now going to stretch out the triceps, which are a bit neglected as well. We kind of forget about those. Now this stretch should feel nice. I'm going to demo it first because there's a couple of different techniques you can use for this if you're in with your shoulders. So what we're going to do is we're going to bring the right hand and just place the hand onto the back of the neck. And from that point, you can either use your left arm to push back and you'll feel this really nice stretch down this part of the arm, or I usually grab hold of my elbow and pull back because I get a better stretching, but that can be difficult if you've got mobility issues in the shoulders. So if you're struggling with that overstretch like that and the pull back, just push back until you feel the stretch running down this section. So I'll just let you all join me now in position and just enjoy that stretch. Breathe in and out as you're in that position. And if you're struggling with the overhead one, just push back in that direction, whatever works best for you. Okay, well done, everybody. Now just relax those arms down by your side and we'll go in onto the other side now, okay? So when you're ready, left hand onto the back of the shoulders or the back of the neck, and then just pull back so you experience that lovely stretch down there. It's really helpful to stretch the triceps out. All that buildup that we get in the fascia that I mentioned at the start is really helpful if you do suffer with those aches and pains in the arms. It can make a huge difference. Also staying well hydrated as well helps to shift everything. So all that toxin buildup can really come out through adequate hydration. And now just let everything just relax down by your side. Just take a nice deep breath in and out for me. Just breathing in through the nose and out through the mouth. Help your body release all that pressure. So by breathing out, we're letting go of that tension. Okay, well done, everybody. So when you're ready, we're now going to take the left arm nice and straight, and we're going to take it up above our head, keeping it nice and straight. I want you to imagine here that your arm's like a bit of a lever. So I'm going to get you to follow me in sequence. So when you're all in position, now slowly, slowly bring that arm down straight ahead of you, keeping it nice and straight, and just stop at your chest height. If your shoulder's sticking up a little bit, just adjust it, make sure it's nice and relaxed at this point. And then we're going to pull the arm straight over the body here. And then we're going to hook in with our right arm and gently pull it a little bit more. And what should happen here is it stretches out the area between the shoulder blade and the spine. Now we're going to increase that from the neck point by looking at the fingertips of the outstretched arm. And we're just going to hold in that position for a moment or two. Okay. And now bring your head back to the center first. And then relax that arm down by your side, okay? We're now going to roll that left shoulder. So keeping the arm nice and relaxed, just roll the shoulder upwards, bend the elbow as you roll backwards, and just repeat that a couple of times, just helping to release any pressure around the shoulder blade. Make sure that the arm feels really nice and light, and then just let the arm fall into a gentle rocking motion forwards and backwards, just like we did before. So hopefully that arm is feeling much lighter now, okay? And then just bring that side to a standstill and we'll repeat on the other side. So nice and straight with that right arm, stretch upwards first. And then when you're ready, bring the arm down like a lever, stopping at chest height, adjusting the shoulder if it's sticking up a little bit, and then bringing it straight across the body. Hooking with the left arm and pull very gently so you increase that stretch point. So it stretches those rhomboids out, the area between the shoulder blade and spine that we can't reach ourselves. Okay, and then when you're ready, look at your fingertips of your outstretched arm. Just hold in that position for a moment or two. Okay, now bring the head back to the center. Relax the arm down by your side. And when you're ready, we'll rotate that right shoulder a few times, just really maximizing the stretch on the shoulder blade. Breathe normally as you go. Well done. Okay. And then just let the arm fall into that rocking motion back and forth. Almost like a pendulum with the arm, just letting it relax, letting any residual tension fall away from it. Well done. Okay. Well done. Okay. So now we're just going to repeat that one that I showed you where we stretch back to stretch this wrist point out. Hopefully it'll feel a little bit easier. If any of you struggled with that to start with and noticed it was a bit uncomfortable, it should feel a little bit lighter now. So we'll just go back to it. So it's just stretching out. And then when you're ready, take a deep breath in. And as you breathe out, just take the stretch a bit further if you're able to. And then just relax everything down by your side. And we'll repeat on the left-hand side. So just taking the hand, pulling back, then breathe in and out. Give the arms a really good shake out now. So just start from the hand point, speed it up a little bit if you can. Imagine you're shaking off all the day's pressures. Like I say, this is really effective if you do struggle with those electric shocks down the arms and that constant aching that can be really debilitating, that weakness as well. Even if your arms are feeling really tired, just gently do it as easily as you can. But any movement and stretching is going to just assist. So just let your arms fall really loosely by your side now. What some of you may notice is that you actually feel quite tingly now around the fingertips and that the arms should feel a lot lighter. So that's quite normal, that's good, because that's really helped to alleviate that pressure. So just now take another deep breath in through the nose and then just out through the mouth. And just repeat that a couple of times. So in through the nose and out through the mouth. Okay, well done everybody. Right, what we're going to do now is we're going to go a little bit deeper into this neck area, and then I'm going to showcase some work just around the jaw, because the jaw, again, it's a real area of tension for some ladies going through menopausal stages, and a lot of ladies that I speak to suffer with, TMJ in the jaw and the ears can feel really, really sensitive around that time. So this whole area can get quite blocked. You know, a lot of ladies have extreme sort of neuralgia and sensitivity around this area in the scalp. So it's good to just know a few techniques to try and release that pressure if you are struggling with any of that. Okay. So first of all, I'm going to teach you how to stretch this point, this muscle from what we call the occipital ridge area at the back of our head that runs down into the shoulder. If you can stretch this bit out, this really helps with that level of tension that can build up in this back area here. So there's a few stages to this particular one. So I'm just going to guide us through it. So what I'm going to do is get you to just turn your head slightly to your left shoulder, not all the way, just ever so slightly. So you're stopping at the point I'm at now. And we're going to drop the chin down towards the chest in that position where we're slightly turned to the left. And then I'll get you to take your left hand and just place it onto the back of your head. And when you're ready, no tugging, but just gently pull forward. And what you'll notice is a lovely stretch here down the right-hand side of the neck. Keep your right arm as relaxed as possible for this and just sit in that stretch point, just breathing as normal if you can. Just hold it for a few more seconds if you're able to. Now don't rush back up, we'll do this in stages. So take your hand from your head first and now take a deep breath through the nose. And as you breathe out through the mouth, bring your head back up at the diagonal first and then slowly back to that central point. Well done, everybody. Let's repeat on the other side now. So take your head slightly to your right. Drop your head forward. So you're looking down at your right thigh. Right hand comes onto the back of the head and gently pull forward so that you feel that lovely stretch down the left-hand side of the neck. Let the left shoulder and arm just hang nice and relaxed for this, and just enjoy sitting in that stretch. Just breathing as normal if you can. Now, when you're ready, take your hand from your head first, and keeping the head down, take a deep breath in. Now, as you breathe out through the mouth, bring your head back up at the diagonal, and then back to the center. Well done, everybody. That's lovely. Okay. So I'm just going to take my glasses off for this next bit so that I can showcase. So just move my fringe out the way so that you can see. So from the corner of the eye to the ear, we're looking at that central point here on that line. So if you can just all with your index finger and your second finger, just reach that point on your left-hand side to begin with. And then when you're ready, with a very gentle pressure, nothing too hard here near the temple area, we're just going to gently go in circular motions like this so that we're moving the tissue on the face in a circular motion and just trying to relax that muscle near the eye. And for this, if I can just get you, once you've got your flow with this, just close your eyes. Very, very good for eye strain and those tired, dry eyes that we can get as well during the menopause stages. So just allowing your body just to be for a moment and giving yourself that much needed moment in time just to help these areas relax. Very, very good for jaw tension, this as well. I'll just do a few more rotations on that side. Okay. And then when you're ready, we're going to go onto the right side. So it's the point from the corner of the eye to there, and it's that central bit. Really light pressure, but making sure that you're moving the tissue, rotating with the index and second finger, closing your eyes if you're able to, and just allowing that pressure just to be released. Okay, well done, everybody. A few more rotations, and then we're just going to move it down slightly to the jaw. Okay. So what we're now going to do is just go on this point just here in front of the, not earlobe, sorry, that's too low down. This little section, I've forgotten what this bit's called, just here in front of the ear on that side. And if you can do it on both sides, index and second middle finger, sorry, and just start to do those same rotations like we've just done. Nice medium pressure for this one if you can manage it. I'm just going to put my glasses on so that I can see the screen in case anybody needs my assistance. Okay, so just rotating. Okay, and now start to work that rotation down onto the cheeks and just stopping at that point. I'm just going to turn both sides to make sure everyone can see so that you're almost in the jaw point here. If I move the second finger, you can just see where I am. This might feel very tender for some of you ladies if you are suffering with any facial neuralgia or TMJ or any conditions like that. So if it's too much, lighten off the pressure and just keep it quite gentle. And then what I'm going to get you all to do is just gently push in and stop the rotation. So you're keeping your hands still. And we're going to open the mouth really slowly and push your tongue to the roof of your mouth. So it'll be like that. And once you're in that position, if you can just close your eyes and just breathe for a few seconds whilst in that position. This significantly helps you to relax your jaw. The jaw can be really challenging. It's almost like it doesn't want to let go when it's got tension in it. So by pushing the tongue to the roof of the mouth, you'll feel the drop as you do that. Your fingers will almost drop down as they're on that point. Okay, well done, everybody. And then just gently just now bringing the fingertips down to the middle and just pressing on your chin. So just close your mouth now and just gently pressing on that central point of the chin. Pushing inwards very gently, and if you can, just breathing in and out. And repeat, breathing in and out. Okay, and one more time, breathing in and out. And now very gently, just with your fingertips, just tap all around that area, all across your cheeks. So you can start near your nose, working out towards the ears, Come back in again, working out, back in again. Just working out to the sides, across the chin and out to the sides. Okay, just to help stimulate the nerve endings. Okay, but nice and gently. Okay, and then just let those arms have a break for a moment. Let them hang by your side. If they're feeling a bit achy, just give them a gentle shake off. So I'm now going to just showcase a little bit of head release because again, that's really important. And especially if you are experiencing tension in the jaw, you're likely to be feeling it here around the top of the head as well. So I'm going to get you all, when you're ready, to splay your fingertips and just anchor in with your thumbs round about here, and then put your fingertips onto the top of the head there, and we're going to start imagining that we're massaging a shampoo but quite deeply into the scalp. So although you'll be able to see my hair moving, I have got traction on my scalp so that I'm really sort of feeling that I'm not just scratching the surface of my hair, because we're wanting to stimulate the scalp. We're wanting to encourage the body's lymphatic flow, which is its cleansing system. So this will really help to bring oxygen and nutrients to the area and get rid of those nasty headaches. Okay. If any of you are experiencing sensitivity with the scalp, you might struggle to even touch in that area. So if that's the case, don't worry about it at all. Just sit this one out and just do some of the breathing exercises. Or if you're able to, you can just really gently stroke across the scalp. But if that's too much even, just like I say, just focus on the breath as we work through this one. And now take your fingertips to the back of the head and just repeat the same, where you're really almost imagining that you're massaging a deep shampoo into there. Okay, nice and deeply into the scalp, really getting traction. And then just keeping your fingertips there, push them inwards and just do a little bit of a juddering motion if you're able to, so that you actually feel the cap moving up and down. If you've not got a big fringe like me, you'll actually notice your forehead is moving up and down on this one. And that's right, because we want to release all that pressure that builds up around that occipital area at the back of the head and neck. Okay, and then if you can, just go to the top and just repeat the same way, just almost moving the skull cap up and down for gentle release. And now when you're ready, we're going to tap all across the top of the head, but I want you all, if you can, to do this firmly. But again, anybody suffering with any sensitivity, just go as light as you need to, whatever's going to work for you. So taking that tapping onto the side and moving it round to the back to the side, all along the top. And now bringing it onto the forehead and more gently on the forehead. So in the center, working its way out, to the side, nice and gently, back to the center, working out to the side, and then very gently back to the cheeks. So starting into the nose, working out towards the ears, along the top of the lip, out towards the ears, and then into the center of the chin and out towards the ears. Okay, lovely. And then now bring that gently onto your chest area. So just nice gentle tapping on here. Okay. Bring that out towards the shoulders, back to the center, out to the shoulders, and then just let those arms fall really loosely by your side. And just start to do that rocking motion that we did before with the arms, where you're just gently swinging them back and forth. So they almost start to feel a little bit weightless. We want any residual tension to move away now. Let it go with permission. So just focusing on those arms starting to feel lighter and lighter. Fingertips nice and light, shoulders nice and relaxed. Now just bring those fingertips onto the shoulders again, and we're just going to have another last go at those shoulder rotations, which should feel a lot better for us all now. For those of you that I can see, that is looking so much smoother than when we started, and hopefully it's feeling better for you. And then if you can have a go at the opposite direction, see how that feels, up and over. Much lighter, hopefully, like a weight's been lifted off. Such a simple movement that we can just apply every day where possible. Thinking about self-care and bringing it into a daily routine, it doesn't have to be time consuming. So you certainly don't need to take an hour out of your day. You can just take 5 minutes where you're just doing these rotations. Even if you just do that, some simple breathing and moving the neck around a little bit, that's going to help support you. Then just let the arms just fall really loosely by your side. Well done, everybody. So we're just now going to go back into the breathing exercise that we did at the beginning. So we're going to try the 3-6 breath again. And if you can all just close your eyes again for this, allow that connection with your mind and body and just get yourself really nice and relaxed in your chair. And when you're all ready, we're going to breathe in through the nose for 1, 2, 3. Now just pause, if you can, just for a couple of seconds. And now exhaling for 1, 2, 3, 4, 5, 6. Just breathe normally, just in between, and then we'll go again. So breathing in for 1, 2, 3. And pausing if you can, just for a few seconds. Exhaling 1, 2, 3, 4, 5, 6. Lovely. And then one more time when you're ready. So breathing in for 1, 2, 3. And exhaling 1, 2, 3, 4, 5, 6. Now, just before you bring yourself back to your surroundings, just cross your arms over your chest. Keeping your eyes closed, just become aware of yourself, just sat there, just for you a moment in time, just allowing your body just to really relax in the chair, being aware of your body just sitting there, nice and relaxed in the chair, just focusing on breathing in through the nose, out through the mouth, and just allowing yourself your moment in time just to be. And whenever you need to, you can just return to this place of relaxation. You can apply it whenever it's needed, whether it's that anxiety waking in the night, it's first thing on the morning, things are feeling a bit pressured in the day, your muscles feel tired and achy, you've got a headache. Using this breathing technique and just focusing the mind and body will really help to just take the edge off those symptoms. And now when you're all ready, just bring yourself slowly back to your surroundings. Just start to wiggle your fingers and your toes a little bit. And just keep your hands crossed over your chest for a moment as you open your eyes, because you can feel a little bit dizzy afterwards. That is quite normal. Just when you feel ready, just allow your arms just to relax down by your side or rest them onto your knee, whatever feels comfortable. Now, just to give you all a little bit of aftercare, because that brings us to the end of the movement side of the session. So well done, everybody that's taken part. You've done a really good job there. You need to drink plenty of water. Being hydrated is one of the key aspects of well-being, because it really supports the blood flow around the body. You know, the blood is mainly made up of water, and if we're dehydrated, it gets quite thick, and it's difficult to get the nutrients and the oxygen to those areas that are needed. So when we're experiencing symptoms in the menopause, like the aching muscles that I mentioned, like the headaches, even the anxiety as well, it can really massively help when we're adequately hydrated. The other thing to bear in mind with being dehydrated is that individual muscle fibres can become dehydrated, and they become more brittle and they become more prone to injury. And especially as our bone density is decreased as well, and our muscle mass is decreased, we need to be really mindful of that. So a really key thing for ladies thinking about hydration. And this can be something a lot of my clients say they really struggle with, the hydration aspect. And what I've discovered, it's actually best if you can get plenty of water into yourself first thing on the morning, because that's when we naturally wake from our sleep. We've been dehydrated for quite a number of hours in the night. So even before we have our tea or coffee, a hot water with a slice of lemon or a warm water is really beneficial for our whole system. And it can really make a difference to some of those symptoms we may experience. So if you're struggling, yeah, just try and do that if you're finding hydration difficult. The other thing that some of you may experience after the session is a little bit of aching, particularly across the shoulders here. And for those ladies that experience this discomfort in the forearms, you might notice it a little bit in there. All of that is quite normal. It should lift after 48 hours max, but probably within 24 hours for most of you. It's a little bit like having a massage session or doing some physio or going to see an osteopath. You guys have done all the hard work yourself there, but you can sometimes feel it afterwards, so all quite normal. So I'm going to hang in here now, just in case anybody wants to ask me any questions around musculoskeletal issues that you might be experiencing. And if anybody wants to ask something very private, what Gersh will do is provide a contact, and then you can come through Gersh privately, and she can let me know and we can respond. Okay. So thank you, everybody. Thanks for all the lovely comments that are coming through. Glad you're all nice and relaxed. So I'm just going to hang on in here and just see if anybody's got any questions.
Thanks, Charlotte. Just wanted to, there was just a question here about the recording. So the recordings will be sent out it'll be some point next week. I'm going to send out a roundup email of the whole week, and they'll also sit on our website. So they'll all be kind of there, and it'll be all the sessions as well. So you can kind of obviously watch other sessions that you haven't been able to attend. But in the chat box, yeah, there's been lots of thank yous. Everybody feels great. I feel great. I've had a day of just staring at the laptop, so I had to check my hair before I came back on, because I was busy zhuzhing it up during the head bit there. But thank you, Charlotte. I'm just going to, if anybody wants to come off mute and ask a question, please do so.
Oh, I'm just looking at some of the comments coming through, Gersh. Yeah, it can be really noisy in the neck and shoulder area. It's quite surprising when you start to mobilise everything. Yeah, if we've got a lot of tension in there.
Yeah, sorry, I was very late joining, so I do apologise for that. It was quite rude of me. I'm sorry, I got carried away. But I get right across my shoulders, and then into the back of my shoulder blades, which the one that I've just seen will really help with. But do you know anything that will free up across my shoulders, please?
Yeah, so I think you might have missed. Did you miss this one where we were doing the shoulder release at the very beginning of the session?
Yes, I did. I'm sorry.
No, not at all. Please don't apologise. So this one is just resting your fingertips on the top of the shoulders here. And then all we're doing is bringing the elbows forward nice and slowly and rolling them back and dropping the blades back down as we go. But what I said at the start is, if you've got areas of tension or restricted mobility, just take these movements really slowly. Stay within your safe comfort zone. So don't push yourself too far. It's all about gentle stretches that are going to support you and not push too far. So once we've done a few of these, you might experience a bit of cracking and crunching as you do this movement. We then went in the opposite direction. So we went backwards first and up and over. So we're lifting the shoulder blades, okay? And that really helps to free the tension. The other one that will be on the recording that will really help you is the pendulum roll that I showcased. And this one is one where we drop the chin down towards the chest, nice and slowly. You may feel that stretch point running quite into the middle of your shoulder blades, even further down your spine. And then just gently roll your chin towards your left shoulder first, back to the center, back to the right. And just repeat a few times. You can go a little bit faster with this one, but just keep it nice and safe. Don't push too far. And this is the one where you may experience quite a lot of crunching and cracking and popping going on there. All quite normal, but I was saying to try and do that one really regularly because we hold so much tension. And ladies going through the menopausal stages, I tend to see they get loads around that area that you've just mentioned. Yeah, a lot of tension, a lot of frozen shoulders as well, and mobility restrictions with shoulders. We hold on to so much stress, and it's not just physical stress. The mental stress can manifest really physically in the shoulder area as well.
Thank you. I am perimenopause, so I do get it. It's just So that's lovely. Thank you very much.
One other thing that I just recommend for you as well is a vitamin D spray. If you're not already using vitamin D during the winter months, you can get the Better You vitamin D spray. You just put 1 pump inside the cheek every morning. That's going to really support your bone health and also muscles as well, because we just don't get the adequate sunshine.
Brilliant. Thank you.
Yeah.
I'll make note of that. Thank you very
Yeah,
much.
so that will really help. From September through to March, I'd recommend using that, and especially if you're in those stages where you're really experiencing a little bit of joint discomfort.
I think we have, oh, sorry.
Got Jackie, have we, Gersh?
Yeah, question from Jackie.
Hi, Charlotte.
Hi, Jackie.
I've been to the sessions before, but in between the last and this one, because of postmenopausal bleeding, my HRT was stopped immediately, and I was on it for 30 years. So I've just been launched into the most horrendous symptomatic menopausal stage, and I seem to be experiencing everything on every list. So I've got this really awful lower back pain that's constant at the moment, and I do yoga and I swim, but it's chronic and it just will not go. And I just wondered if there's anything in your sessions that might help with that.
Oh, I'm sorry to hear that, Jackie. That sounds really challenging. Have the doctors talked about any HRT alternatives, like the body mimicking ones that are available now, that are actually really quite safe to use in certain circumstances like that?
Because of the postmenopausal bleeding, I've got atypical cells in the uterus, so they're on the change, I suppose, and so they've fitted a hormone coil, which was horrendous. But that's it. And just to even get to that stage, it's, you know, it's really difficult to get anything else, because I've been treated really quickly, but then I feel like that's it. I've got to live with this now.
That's really difficult when you're suffering with discomfort like that. What I'd recommend for that, Jackie, is gentle Pilates for pelvic and core health would probably be the best form of exercise that you can do. Even sometimes yoga can be a bit much in those circumstances.
Yeah.
And Pilates is a rehabilitative form of exercise, and a lot of Pilates tutors can specialise in pelvic health around the menopause as well. So this would help. What we could look at doing is getting to Gersh a pelvic health information sheet, and have you got a stretchy band, Jackie, that you can use, one of these Pilates bands?
No, I haven't actually. No.
I'm just looking around to see if I've got, oh yeah, just bear with me 1 second, I'll just grab mine to show you. These resistance bands can be really good. You can get these on Amazon, and they really help to build in resistance around bone health, and you can use these and you can do pelvic exercises, you can do shoulder exercises as well. But I'll see if I can just get to Gersh, like I say, to send to you something around pelvic health and some key core exercises, because if you can work around strengthening the core muscles a little bit, this will just help to, especially if there's inflammation in that area because of the bleed, this will just help to support the muscles a little bit and take away some of that discomfort that you're experiencing.
Oh, that sounds fabulous. Thank you so much.
No problem at all. I'll get that over to Gersh at the end.
Jackie, would you be able to drop me an email address? I'll drop you drop me an email with your email address. I'll send you my email address, just because we've got quite a few Jackies on here. Not too sure which one it is. And then, yeah, I can get that information across to you.
Do I need to put that in the chat box or on your box?
Oh no, just I put my email address in the chat box. If you send me an email, and then I've got your email address, and then we can send it across to you. Is that right? Yeah.
Great, thanks.
Thanks, Jackie.
Brilliant. Are there any other questions?
Could I have those exercises as well, please?
Yeah. Again, do you want to drop me an email? And
Yeah. Thank you.
Just with your request, just because we've got so many requests coming in, I can go through them one by one. Brilliant. Well, thank you very much, Charlotte. I know I've taken a lot from that, and I'm not even going through the menopause, so and I'm sure these ladies are. But thank you all for attending, and I hope you can all also join the rest of our sessions that we've got ongoing this week as well. But it's been a really great session, so thank you very much, Charlotte, and thank you for your time. And we look forward to seeing you all soon. And again, Charlotte, just to kind of mention, if you do have anything specific that or something that you don't feel comfortable about talking about now, again, just drop me an email and I can send you on to send you Charlotte's details to ask directly, if that's okay.
Absolutely, that's fine, Gersh. I just noticed somebody else is in the chat has asked for the pelvic exercises, Gersh. So I think that's a lady called Jane. So it's just making sure if we've missed anybody, but we can run through that afterwards and make sure. So I'll get that over to you.
Yeah, definitely. So anybody who doesn't want any of them, my email address is in the chat function. Drop me an email with the request and I'll ensure that we get it across to you.
Thanks, Gersh. That's great.
Brilliant. Thanks so much.
Thanks,
Take care,
everybody.
everyone.
Thanks
Enjoy
for
the rest of your days. Bye.
Thanks for joining in. Take care. Bye-bye.
Thank you so much.
Thank you. Bye-bye.